Okay, I wanted to go through today with you guys, showing you a functional movement that I do with most of my clients. Anyone coming in pretty much with pain from their mid back down, I look at this functional movement pattern. I say it that way because it's something that you probably have to do throughout the day. Maybe not to this extreme, but again, I like to practice one extreme to the other, so that way in your normal daily movement, you are at lower risk for injury. So if you practice outside of the range that you need for the daily stuff, then the daily stuff won't trip you up and give you pain throughout the day. So that being said, be careful if you have a diagnosis of a specific back injury. I would obviously check with your doctor before doing this. Anyone with a knee or hip replacement, just be careful. I don't recommend going into these extreme positions, but that's not to say anyone with a knee or hip replacement can't do these motions. Just listen to your body, and there might be some discomfort, but should not be purely pain that won't go away after you're out of the movement. So just move slowly, and I'll show you some modifications along the way. So let me show you first off what we are trying to get to. Again, it's a goal for my patients, and most get there pain-free, but not everyone. Some people, just specific reasons why they can't get there. It's gonna be this deep squat functional pattern. So if you see babies playing, they like this pattern a whole lot. Other cultures sit in this pattern a whole lot. So we know it's good for the spine, it's good for the hips, knees, ankles, everything. It's just our culture does not really set us up to be very successful with that position. So what you want to do if you are starting and going into this position newly, have not been there before, the number one thing you want to do is probably look at some of the other videos that I've posted on lower body stretching, because you just want your hips and knees a little bit stretched out before you go right into this position. But otherwise, what I will suggest and have you go through the phases that I do with a lot of my patients is the first time we do this, I elevate the heels. Okay, that way. I also usually have something sitting in front of them, which we'll get to later. But if I'm going to break this down, I'm going to first have them elevate their heels on something, a pillow, a rolled up towel, whatever it may be. And then they're going to try to sit back in a squat. If you do that, you'll realize that you don't get as much jutting forward. So for those of you that try to squat down and you cannot get your heels down comfortably, go to that elevated heel position. Nice wide stance, so your toes can be turned out slightly is fine. And you're gonna hinge at your hips, not bending your back, and then bend the knees as deeply as you can. And I say just kind of play around in this position. It's normal to sometimes get a little pinching in the hips. Sometimes I even do. And what I do is I just kind of I rock back and forth a little bit, trying to keep the weight through my heels so that I'm not jutting forward. And I just kind of sit there to your tolerance. Everyone's different. And then come up and kind of shake it out. So usually in the mornings, if I'm super stiff, I get a little bit of pinching in the hip. So I know that's not uncommon for myself. Just kind of knowing where your areas of tension are is fine. So another option I give my patients is to hold something. So you want to keep that nice hinge at the hip. So if you're holding onto something low like a bench like this, do not round like that. That's not a great way to start this movement. You want to slightly bend the knees, widen the feet, and then sit your hips back. So you're already getting that nice hinge at the hips, keeping your back flat. And then from there, you're going to sink back onto your heels and try to keep the chest up, so you keep a nice straight back there. So again, not rounding forward here. If you get stuck here and feel like the rest of you has to round forward, then just stay here, okay? So again, you can kind of play with this, especially if it's a bench or even a table that's a little bit higher. You can play with this. So back nice and straight, bend the knees, and you can just kind of sink back. So if that's a little bit of discomfort, that's okay. You can move in and out of that position until it becomes more comfortable, and then kind of see if you can sit there for a minute in that bit of discomfort. Breathe. As long as you're not getting any sharp and shooting pain, a lot of times your body can acclimate to the new position that you're in. Good. And then you can move out of that. Again, you can combine these two movements. You can do both. Have a little towel roll or pillow under your heel. Bend the knees, hinge at your hips, and then you're just sitting back. And that's easier even if you combine them. So even if you start there, that's completely fine. And again, I like to kind of rock side to side. You're going to be kind of what I call greasing the joints. You're going to be moving circulation through your hips, your low back, and even your ankles, your knees, all that good stuff. Okay? So that is a build up to then being completely independent and being able to do that nice deep yogi squat. And have that nice tall posture at the bottom. So kind of play with that and see what you guys can get.